Mr. Stock, would you like to lead us to the Pledge of Allegiance?
Yes, sir.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone. Welcome to the Shawnee County Board of County Commissioners. It's July 9th of 2020. On my left is Commissioner Aaron Mays, who represents District 3. On my right is Commissioner Kevin Cook, who represents District 2, and I'm Bill Rippon, and I represent District 1. Cindy, what's first on the agenda?
First item is item 3, consent agenda.
I would move that we approve the consent agenda.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business A, County Clerk number 1, consider all voucher payments.
Commissioners, this morning we have vouchers that total $1,143,236.46. The largest expenditures are workers' compensation, $276,807.71. The second highest is holding accounts with the state of Kansas, $247,878.21. We had health insurance premiums of our employees of $189,861.76. And then finally, the fourth highest expenditure is Parks and Recreation. It was a number of different expenditures, but they did total up to $141,008.85. I don't have any questions regarding the vouchers and would move for their approval.
Second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item A2, consider correction orders.
I move that we approve the correction orders.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All those in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B, Bond Council number 1, consider approval of resolution number 2020-43, acknowledging a petition filed by 100% of the owners of the land affected and approval to create Green Hill Point subdivision, Shawnee County, Kansas benefit district, street benefit district, authorizing construction of street improvements at an estimated cost of $420,000 with 100% apportionment of the improvement cost to Green Point subdivision and 0% to the county.
Good morning, Bob Perry. Since this is the first street benefit district that Aaron and Bill have had to consider, I thought I'd kind of give a little bit more explanation of how this works. Basically, under KSA 68-728 at SEC, owners of ground that own 50% or more of the ground that's been laid off and lots and blocks been platted can request the county to construct and install streets with the cost thereof being assessed back to the owners benefited by the street benefit district. In this case, Michael Drape Development LLC has requested that a street be constructed to serve 16 lots in the northwest part of the county. It's northwest 49th Terrace. It's northwest 49th Terrace. It's off of Northwest Green Hill Road. Once the streets are constructed and the costs are ascertained, we'll assess those costs against the lots benefited on a per lot basis. There's 16 lots. We'll issue general obligation bonds, and those bonds will be retired over the last 20-year period of time from the assessments. In the past, on this size of a project, the county basically has financed it on an interim basis and charged the developer interest at the end when we go to permanently finance it. It's my understanding the developer is going to pay for the sewers and the water installation himself. Under the county's public policy, the code requirements, the developers posted a 20% surety bond in the form of a cashier's check in order to cover a non-payment of assessments if that's due. He's also executed a guarantee both in his capacity as the LLC and personally guaranteeing the payment of all special assessments due and unpaid as long as he owns any lots or blocks in the subdivision that have benefited from the streets.
Any questions?
Yes, please, Mr. Chairman. Bob, is this a completely new development, or is this a parcel that had been plotted in some time ago and is just now being developed.
My understanding is this is a raw piece of ground that he owns. It's about 160 acres, of which he's got 16 lots right now that's platted. Is that correct?
There was 18 lots that were platted approximately 3-4 months ago.
Okay.
There's 18 lots.
So this is completely new development.
Yes.
That's
If
great.
you- If you drive up on North Hills Green Roads, which I did the other day, it's, right now it's a field.
Okay, great, thank you.
All right. Any other questions?
I'll move for approval, noting again that there is no liability to the county, and it's just for development and improving the northwest, or north part of Shawnee County.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you, guys.
Next item.
Item C, elections. Number 1, consider approval of request to hire for the vacant election manager, administration, and board worker position at an hourly rate of $23.02 with an expected hire date of July 20th, 2020, with funding from the election office budget.
Good morning, Commissioners. Andrew Howell, Shawnee County Election Commissioner. We have conducted interviews. We have, we believe, selected a very well-qualified applicant and would like permission to hire that person at the proposed rate. If you have any questions, I'd be happy to try to answer those.
Any questions?
No?
I'd move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Andrew. Next item.
Item D, Administrative Services. Number 1, consider approval of request to create a new fund for all approved COVID-19 reimbursements for Shawnee County and other local taxing authorities within Shawnee County associated with the Coronavirus Relief Fund monies.
Good morning, Betty Griner, Director of Administrative Services. As you know, the CARES Act created this Coronavirus Relief Fund that was distributed to the states. The state is distributing part of that money to the counties. The counties will use it for their own coronavirus costs, as well as sharing that with local taxing authorities within the county. So what I'm requesting here is just to set up a separate fund that all of those monies will be accounted through. It is right now anticipated that the state will distribute those monies on July 15th. So I would like all of that money that the county receives to go into this new fund, and as reimbursements are paid to either the county or to other entities, then that money would come out of here so that it's all self-contained into one fund and will be much more transparent and easier to account for. So I'm just asking for the approval of the fund.
Any questions?
No, I'll move to approve.
I'll second. Motion's been made by Commissioner Mays, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Betty.
You.
Next item.
Item E, Health Department. Number 1, consider approval of request to fill a second epidemiologist position in the Infectious Disease Division at an annual salary including benefits of $63,470 with funding from the 2020 and 2021 departmental budgets, and to fill any subsequent position that becomes vacant from filling this position.
Good morning, Commissioners. Linda Oakes from the Health Department. So this is kind of a long story. You might remember in January I came to you and asked for a second epidemiologist position so that maybe we could hire someone before our current epidemiologist left to do some training. Well, you approved that position, and we were not able to find anyone to fill that position, and our epidemiologist left. So we've been trying to fill that original position, and still no luck, so we're going to reopen it. But now we do have a need for a second epidemiologist to work with our COVID-19 response in the Infectious Disease Division. And so I would ask that we could go ahead and fill this. We're going to try to find 2. I know it's difficult. I just don't know what else to do but to keep trying to find people to fill these positions that we need. So we have Kansas Health Institute on board, and they are starting to help us with our data and our metrics analysis, but we really do need these epidemiologists on our staff so we can continue that work and work with our community health outcomes, with our tracking our progress, helping us with those things from the county health rankings and other our community health needs assessment, other needs in our community that we know are still there and still going to be there when COVID-19 is over. So I'd be happy to answer any questions.
Where do you recruit for a position like this?
Everywhere. I mean, we did a lot of Indeed. We also send out to the universities that we know have masters in public health programs. Yeah, we use Indeed a lot, so.
Commissioner Cook?
Linda, this is just more of a practical question. A lot of what this position does is data analysis and looking at trends and looking at so we can basically go upstream to see what our best practices are. Am I right?
That's a lot of it, yes. Mhm.
So why would we limit this position to just a health certified position and not a person who has a background in quantitative analysis or data analysis or, for example, at the Greater Topeka Partnership, they have a person on staff who looks at trends and analysis when it comes to workforce development, when it comes to your housing prices, when you come, I mean, just again, to know what the makeup of the county is. I mean, can we go to somebody who's maybe more qualified in that quantitative data analysis and not just a health position?
I think we could look at that. I really do want to try to get someone with that master's in public health, just because health is so, it's a specialty, and that public health specialty is what we want, that expertise. I do understand what you're saying, and it's a good idea. I think we could broaden our search if we can't find the people that we need in this. But, you know, I also want people to be able to do our epidemiology newsletter and understand about public health and all those things that go into that, which is not just, you know, communicable diseases, but it's also sexually transmitted diseases. Mm-hmm. It's also chronic disease risk reduction. There's several areas that I want to be able to work in. So trying to think broadly, but I will consider that, and we will look at that. Thank you.
Any other questions?
No.
What's your pleasure?
I'll move for approval.
I'll second.
Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Linda.
Thank you, Commissioners.
Next item.
Item 5, Administrative Communications.
Okay, at this time, we'll open the podium up to the public. If you have any comments or anything you'd like to share with us, or department heads.
Good morning, Commissioners. Linda Oaks from the Health Department again. During our budget hearing this week, I believe Commissioner Cook asked about our volunteer time and hours, so I wanted to talk a little bit about the volunteer work that's going on with COVID-19. So during the period from March 23rd to June 30th, we actually had 64 volunteers working for us with a total of 1,939 hours. And so if you look at with the FEMA reimbursement rate of $12.82 per hour, the total is $24,858 in value that we received from these volunteers. And that's just the monetary value, not the tremendous support they've given us through the testing, through the phone bank, through contact tracing, through monitoring folks on isolation. So I asked Carolyn Ward to come up today. I'm going to have her come up. I wanted to introduce her to you. She is our volunteer coordinator. And I didn't know Carolyn before all this started, but she has absolutely been a lifesaver through all this. So Carolyn, if you just want to talk a little bit about your background and what you're enjoying about this. How's that?
Good morning, Commissioners. Carolyn Ward. I have been working with the Emergency Management Department and Shawnee County Health Department since the end of March as their volunteer coordinator. And my background, I have 30 years in public administration experience, so most of you know me in some other capacity, as I've lived in Topeka since 1993. So, but I'm just happy to help, and we're continuing to recruit volunteers, as you know. The workload is not decreasing, and so we can use volunteers in a variety of ways and continue to recruit for good, dedicated people, and especially as volunteers that we have been filling the void with have been some teachers and school nurses, and their availability is shrinking as time gets closer. So we hope to continue to have the community support. Thank you.
Thank you very much for all your work.
I just want to add that Carolyn tracks all the time. She takes care of all the forms they have to fill out. She helps with the training. She's just been a tremendous asset to this response, so I really appreciate her.
Linda,
Yes,
I've got you. What do our numbers do this week?
So I believe, as of last night, we had 95 new cases this week, and there were another 21 in there this morning. So we're still continuing to increase. I don't know if we're going to double this week. I'm hoping not. But that is what we're looking at. And of course, as I'm reporting to you, we are still trying to get cases out to be investigated. We're still about a day behind. We've caught up a little bit because we brought on board a big group of new volunteers, and the contact tracing company continues to onboard workers. So we're moving. It's just hard to catch up.
How are we doing on hospitalizations?
I believe there's 13 hospitalizations on the dashboard this
So
morning.
that went down?
I-
If we had 13, we went down to 10. If we go back up, that's,
I think it's staying around the same. And
That's,
I'm glad you asked me these questions, Commissioner, because I did forget to mention. So we normally have those charts for you today. Because we have been so overwhelmed, we're going to have to delay that till Monday for last week, because we don't have the data in the system to pull yet. The nurses are trying very hard to catch that up. I think they're up to Friday in putting in data. So hopefully we can get that caught up and have those charts for you on Monday.
Okay. Thank you.
but Linda, the information that is online, it always has a as-of date.
Yes.
And so whatever date is on that corner is, the information is accurate as of that date.
Yeah, the dashboard we are updating daily during the week. We're not updating it on the weekends anymore, because again, I had to give people time off. But the charts that we usually bring you are what we don't have quite done yet.
Okay, but you can go to the dashboard
Yes.
and you would be able to see the confirmed, the active, the recovered,
Yep.
the hospitalization, and the death.
That's correct.
Thank you.
Thank you.
Will there be a health meeting today? A health,
No, we don't have a health meeting scheduled
Okay.
today.
then I'm going to speak now.
Very good.
And it comes into play with what was just
Be sure and
said.
give us your name.
I'm sorry, Tammy Hunt.
Okay, thank you.
And today I'm going to actually stick to my sheet, because honestly, you'll understand why. Okay, commissioners, I'm absolutely appalled at what I see it taking place. 2 weeks ago, Dr. Pizzino agreed that going to Walmart, Dillon's, or Home Depot was not a danger without a mask. That incidental contact for short periods of time would not spread the virus. No masks needed for the general public. That's what his decision was in this room. Then, a few days later, Governor Kelly issued an emergency mask mandate, an emergency that wasn't necessary to do anything for 4 more days. That does not constitute an emergency. Interestingly, this happened just in time for our July 4th, our Independence Day celebration. As soon as that order came out, Dr. Pizzino changed course and wanted a mask mandate. Apparently, marching orders from the top were well taken. The data from the Shawnee County Health Department showed, and we all agreed on it, 0.38% tested positive, 0.38% of our population. 0.01% have died from the COVID disease here in Shawnee County. 0.01% were currently hospitalized. And 0.1% of Shawnee County population was currently active with COVID. Now, there was a lively debate in that meeting without any disagreement about this data. That data was taken directly from the health department's website. The bottom line is that data at that time absolutely did not indicate a need for a mask mandate, and everyone involved knows that. There was clear. There was no mask mandate needed. This discussion also contained a fair amount about the unenforceable nature of the mask mandates. Hello, HIPAA. I'm here without a mask. You can't make me abide by that because of HIPAA laws. I don't have to tell you anything. You can't enforce that. So fast forward to the work session and mask mandate on Monday, July 6th. Population, this is from the data from the website that was available to you. Population in our county, 176,875. There are active cases of 273. Now, we didn't know, and we still don't know, how many of those are asymptomatic or simply tested because they know someone who tested positive and they were found to be positive because they were asymptomatic. There were 433 being monitored. I'm assuming that's contact tracing and you're saying you need to quarantine. The deaths were at 13. The hospitalizations were at 10. And on that day, that was 0.154% of the population testing positive with COVID. Now, if you also include all of those being monitored, it's still 0.399%. That's less than 0.5% of our population of our county. The CDC stated last week that we, as a nation, are falling below the epidemic threshold, currently 5.9% death rate. Obviously, there are locations with higher and lower data, and we would never want to compare Kansas to New York or California, but apparently Shawnee County is being compared to Waco, Joco, and Sedgwick. Shawnee County is not even close to these epidemic numbers. That would be, according to the CDC, epidemic numbers would be 5 to 7% death rate. At 5%, that would be over 8,800 deaths in Shawnee County. At that level, we would absolutely have to take drastic measures. But we have 13. That is 0.007%, or rounding to 0.01%, as I've already listed. The hospitalized remain at 10, which is a 0.006%. Now, do not misunderstand me. I'm not discounting any of those deaths. They were someone's loved one and should not be marginalized. But there have been 13 deaths in Shawnee County, but there are 176,862 people who have survived. Think about that number. Okay, we're going to move on to the 7th of July. Active cases of 291, up 18. Monitored cases to 357, which goes down 76. And recovery cases went up to 540. That is up 7. So there's 58 cases that are not accounted for in those numbers. However, they did come back into play the next day when the data caught up. On July 8th, yesterday, there were active cases of 281. That was down 10. Monitored cases that are now 377. That's up 20. And recovery cases are now 596. That accounts for most of those 58 cases that were missing from the day before. Okay, and through it all, we have tested 14,951 people, and that is a 16.8% positive rate. Absolutely, a little higher than what we'd like, but that's since March. That's almost 5 months. Now, I don't know how many of these were asymptomatic, but we do know how many were hospitalized. I don't have that number over the entire period of time. I did not keep track of that for the lengthy time. But I do know that we never once overloaded our hospitals. So with all of these low numbers, why are we in this position? Why are we here? Commissioner Cook, you clearly indicated that statewide orders was inappropriate and should always be determined at the local level. I heartily agree. Heartily agree, I'm sorry. You mentioned your concern that some of your constituents would be burdened by the cost of masks, that the type that could be changed several times a day, because they need to be changed to maintain any type of health. I thought that meant you were going to look at the data. Instead, you mandated mask wearing and even went so far as to implement fines of up to $2,500 for non-compliance of an unenforceable law. You cannot enforce these laws. Absolutely, and you threatened a $2,500 fine. I don't even know how you got from point A to point B with that. Commissioner Mays, you said you wanted kids back in school next month. if you want to have kids with any kind of consistency, with outdoor recess, social activity, or fine arts classes during the school day, you're going to have to get them social now. Kids 10 and under, now you've required them not to wear a mask, which is a vast improvement, but I would counter that every child should not wear a mask. When you look at the data, the kids are going to be better off to get this virus now instead of disrupting the school year or causing untold trauma because of the boot camp type restrictions these school districts are thinking about. That is a travesty for our children. This virus is not going away. It will be here. We need to figure out how to manage it well, not avoid everything. You're only prolonging the inevitable. I've heard repeatedly that the healthcare workers are overloaded and cannot keep up. I've heard it said here that they cannot do their own jobs but are consumed with COVID duties. I am absolutely sure that is true, and I feel for those workers. But maybe if we could stop mandating what everyone agreed last week was unenforceable, those masks laws that now come with a high price tag for noncompliance, if you would stop investigating every possible infringement of the ever-changing requirements, and allow the good people of Kansas to take charge of their own health and their own businesses, the employees might actually have a chance to breathe and recuperate from this nightmare that has been imposed on them. We have always been encouraged to look at the numbers, but that's not happening now. The only number now in vogue is the number of cases, which is actually irrelevant. The number of hospitalizations and deaths are what we should be watching. Remember, we were in this for flattening the curve. Apparently, the goalpost has been moved again. And I'm crying foul, or cheat, or lie, or whatever is applicable. These orders and mandates are not about saving lives or maintaining personal health. If those were the hallmarks of this almost 5 months of overreach, then abortions wouldn't have been the only elective surgery allowed during the lockdown. Whether pro-life or pro-choice, we can all agree abortion is about death, not life. Now, I know people who were required to compromise their own health or died simply because they couldn't have the, quote, elective surgeries that were needed. There's been several in our community. That's not about saving lives. It has nothing to do with saving lives. If the health department was concerned about good health, it would be all about teaching people how to build up and maintain their immune system and how they can be proactive in their own health choices. Instead, the healthy were quarantined, and the health department continues to recommend or mandate all of us to compromise our own health by living in a mask or hiding at home. It's absolutely ludicrous. I've been here for several weeks listening to the discussion, adding my input, and seeing what's happening. I have a stake in my community. But it isn't my civic duty to obey ridiculous and nonsensical orders without question. The Declaration of Independence has 3 main points. First one, people have certain inalienable rights, including life, liberty, and the pursuit of happiness. Number 2, all men are created equal. Number 3, individuals have a civic duty to defend these rights for themselves and for others. My civic duty today is to call shenanigans, to defend the rights of the people. I do not know whether you're following a political agenda, a hunger for power, or simply a fear of standing up for truth. Only you can answer that. There is nothing in the data that would account for the restrictions and mandates we are being expected to obey. The fear-mongering and panic-pushing by those in authority needs to stop immediately. Commissioners, you are on a slippery slope. Your words absolutely have consequences, and your actions speak loudly to the allegiances you hold. My reminder to you is to get your feet on solid ground, to mean it when you say the Pledge of Allegiance to our flag, to stand for truth, regardless of your own particular motivations. Thank you.
Amy, that was very well put. Thank you very much. Anyone else?
Good morning, Commissioners. Andrew Howell, Shawnee County Election Commissioner. Just a reminder, Tuesday, July the 14th is the last day to register to vote. I'd like to mention that because one of the things I really want to encourage people to think about, I every year get a complaint or two about provisional ballots. The reason I like to mention the deadline to register to vote is you can actually prevent a provisional ballot now by getting your registration. If that's the problem and the reason your ballot ends up being provisional, if you will take the time to register, check your registration, call us if you need to. We're happy to help with that. But the law does require you to have your registration updated. Additionally, we're going to be putting out a press release. We have nearly 40 locations throughout the county that people can pick up a registration card. Again, call us at 251-5900 if you'd like some help or have other questions about that, but just an encouragement for people to check their registrations. Thank you.
Thank you, Andrew. Anyone else? Commissioner Mays, do you have any comments?
Nope, nothing from me.
Commissioner Cook?
Nothing this morning. We continue budget hearings.
Yay.
Yeah. I don't have anything to add either, so. What's next on the agenda?
Item 6, executive session.
We have no need for executive session, so we're adjourned.